We live in a data-rich society where the amount of available information is both empowering and overwhelming. It can be difficult to determine which pieces of information are most important for different purposes, such as determining the systemic health of a city. We are surrounded by rankings of cities, which are determined based on subjectively selected criteria. There is a need for an objective method to select variables to contribute to systemic indicators of integrated health. By combining these methods with content knowledge, we hope to identify the most useful information for accurately characterizing systemic health. We introduce a novel method for inferring a functional network from big data that can inform this variable selection. The network finds the most meaningful interdependencies among pairs of variables, which then informs variable selection. The underlying concept guiding this method is called maximum transfer entropy. Transfer entropy represents the amount of information contained in one variable about another, considering both histories. In this way, we build optimal information networks, which contain the necessary and sufficient information for predicting systemic variable patterns of complex systems, such as integrated health of a city. Using transfer entropy, we build the optimal information network, which contains the most meaningful connections among pairs of variables. Inclusion of connections in this network, referred to as edges, is based on transfer entropy values and selection of a threshold for inclusion. Including too many or too few edges in this network can lead to oversaturation of information or inadequate information. This network is the optimal information network because it maximizes the useful information from the dataset while avoiding redundancy. Because transfer entropy is directed, all of the edges in the network have arrows. That is how data reduction is inferred. This variable has many arrows pointing into it, suggesting that other variables contain its information. Therefore, it does not contribute much unique information and will not be included in our systemic health indicator. Based on remaining variables, we can calculate an integrated health measure. An example is shown in these maps. In our example, higher values of integrated health indicate worse systemic health. The dots on the map represent integrated health in different U.S. cities, with green dots indicating low scores and better health, and red dots indicating high scores and worse health. In our dataset, some cities, such as Detroit, have high values, indicating worse health for all years. Others, such as San Francisco, have low values and good health for all years. Some cities, such as Philadelphia, show variation among years. Cross-sectional comparisons show that cities in California tend to do better than the rest of the country in terms of health, and Midwestern cities tend to have worse health outcomes, which contradicts previous work. Through optimal information networks, we can estimate probabilities of cities to have good or poor systemic health. The distribution of our calculated integrated health metric shows these three ranges where integrated health values typically lie. Tipping point theories suggest that it is difficult to move across these ranges, evidenced by the fact that there are few cities that have values lying outside these three groups. This suggests that, unfortunately, it is very difficult to build a very healthy city. Optimal information networks have extensions outside of building an integrated health indicator. By incorporating other factors such as transportation, food systems, or geographic features, we can determine the most important connections with various health outcomes. Examples include influenza, foodborne diseases, and waterborne diseases. Works such as these are useful in a variety of contexts by processing data in real time. Our model can be applied to various complex systems, such as ecological or financial systems, for the unbiased formation of systemic indicators. Stakeholders' values can also be included to aid decision-making. You can read more about our paper in Science Advances and contact the Complexity Lab.